Now we will discuss about the preventive medicine lecture notes, immunization and disease prevention 2023 guidelines. Part 1, adult immunization guidelines, influenza and flu. Routine for everyone more than 6 months. High dose version for adults more than 65 years old. COVID-19 routine for all adults more than 19 years old. Unvaccinated, 1 dose of updated Moderna, Pfizer or 2 doses of Novavax series. Previously vaccinated, those who have got vaccine before, 1 updated dose more than 8 weeks after last dose, after last shot. MMR, measles, mumps, rubella. High risk adults, healthcare workers, college students, they need 2 doses. Others more than 18 years, 1 dose. So it's important note is past disease history is not accepted as proof of immunity. Pneumococcal, adults more than 65 years or younger adults 19 to 64 are more at risk. Options: PCV 15, PPSV 23 or single PCV 20. So these two are very important. PCV 15, PCV 20. So these are very important for pneumococcal infection. Tdap is tetanus, diphtheria and pertussis. So T is tetanus, diphtheria and pertussis. 1 dose for adults 19 to 64. Replace TD booster. So 1 dose is for people, adults that are 19 to 64 years old. Hepatitis B, 2, 3, 4 dose series for unvaccinated adults that are 19 to 59 years old. It prevents chronic hepatitis, cirrhosis and liver cancer. So hepatitis B vaccine is 2, 3 or 4 dose series for unvaccinated adults that are 19 to 59 years old. Human papillomavirus or HPV, routine for ages 9 to 26. Ages 27 to 45 shared decision making. Prevents persistent HPV infection and cervical abnormalities. For ages 9 to 26, it is routine, and 27 to 45, it is decision making. And this HPV vaccine prevent HPV infection and cervical abnormalities. RSV or respiratory syncytial virus in pregnant patients that are in 32 to 36 weeks, it is 1 dose. In pregnant patient 32 to 36, it is 1 dose. Adults that are more than 60 years old share decision making, especially chronic illness, immunocompromised. So 1 dose is for patient. Now we will discuss about the part 2, that is HIV prevention and herpes zoster. HIV screening. CDC recommend ages 13 to 64. USPSTF ages 15 to 65. Early ART reduces transmission, AIDS events and death. So what is ART? ART is antiretroviral treatment. So it is for HIV. So it reduces AIDS events and even death. So it is antiretroviral treatment is for HIV patients. PrEP. What is PrEP? It is pre-exposure prophylaxis. Daily pill. Daily pill is tenofovir plus emtricitabine. So pre-exposure prophylaxis or PrEP, we provide tenofovir plus emtricitabine. It is highly effective for high risk HIV negative individuals. And condoms are still recommended for pre-exposure prophylaxis. And condoms still recommended for prevention. So now we will discuss about PEP or post-exposure prophylaxis. So combination antiretrovirals must start within 72 hours, reduces transmission risk by 80%. Herpes zoster or shingles, reactivation of varicella zoster virus, Shingrix vaccine for immunocompetent adults more than 50 years. So this vaccine, its name is Shingrix. It is used for immunocompetent adults, those are more than 50 years old. So for herpes zoster or shingles, Shingrix vaccine is used. Herpes zoster or shingles, reactivation of varicella zoster virus, Shingrix vaccine for immunocompetent adults more than 50 years. Now we will discuss the part 3, cardiovascular diseases prevention, global burden. It is leading cause of death worldwide, more than 20 million deaths in 2021. Risk factor of cardiovascular disease. Modifiable risk factors are smoking, hypertension, and lipid disorders. These are modifiable risk factors. Non-modifiable risk factors are age, sex, and family history. These are non-modifiable risk factors in cardiovascular disease. Abdominal aortic aneurysm or AAA screening. Abdominal aortic aneurysm screening. Men 65 to 75 who ever smoked, one-time ultrasound. So screening for abdominal aortic aneurysm is the men who are 65 to 75 years old and they have ever smoked, one-time ultrasound is necessary. Screening is not recommended for women without any risk factor. Aspirin use. Adults 40 to 59 at risk, individual decision. Adults more than 60 not recommended for primary prevention. Adults 40 to 59-year-olds at risk, it's individual decision. Adults who are more than 60 not recommended for primary prevention. Blood pressure. Screen all adults more than 18. Confirm outside clinic before treatment. Statins. Adults, those are 40 to 75 with more than one risk factor plus 10 years plus more than 10 year risk, more than 10%. Adults 40 to 75% with more than one risk factor plus 40-year risk of more than 10%. Diabetes screening. Overweight obese adults 35 to 70. Lifestyle counseling. Diet plus physical activity for adults with cardiovascular disease risk. Part 4 is tobacco use and smoking cessation. Health impact. Smoking. Smoking is leading preventable cause of illness and death. It causes cancer, cardiovascular diseases, and COPD. Second-hand smoke, 1.3 million deaths in 2019 due to smoking. Clinical role. Ask all adults about tobacco use. Advise quitting plus provide interventions. Only 4% succeed without help. Clinical role is ask all adults about tobacco use and advise them for quitting and provide interventions, and only 4% succeed. It's pharmacotherapy. Nicotine replacement therapy or NRTs like patch, gum, lozenge, inhaler, spray. Avoid food, drink within 15 minutes of gum or lozenges. Bupropion. Bupropion SR. It is dopaminergic, noradrenergic reuptake inhibitor. Varenicline tartrate. Varenicline tartrate. Nicotinic receptor partial agonist. Duration 3 to 6 months minimum. Its duration is 3 to 6 months. Glossary and key medical terms. CIN, cervical interepithelial neoplasia, precancerous cervical cells. So CIN are precancerous cervical cells. HPV VLP, virus-like particle technology that is used in HPV vaccine. PCV15 and PCV20. Pneumococcal conjugate vaccine protect against 15 or 20 strains. PPSV23. Pneumococcal polysaccharide vaccine 23 strains. TD and Tdap. Tetanus and diphtheria toxoids. Tdap includes pertussis. PrEP or PrEP, daily preventive HIV medicine for high-risk individuals. PEP, emergency HIV medicine within 72 hours of exposure. PrEP is PrEP vaccine is treatment that is before exposure to HIV, and PEP is emergency HIV medicine that is used after exposure, after 72 hours of exposure. Abdominal aortic aneurysm, dangerous swelling of the aorta. NRT, nicotine replacement therapy. Those are patches and gums, etc. Overall summary: vaccination. Vaccinations protect against flu, COVID-19, pneumococcal disease, Tdap, MMR, hepatitis B, HPV, and RSV. HIV prevention screening is PrEP, that is before exposure, and PEP are essential to. PEP is post-exposure prophylaxis or after exposure to HIV infection. CVD prevention, cardiovascular disease prevention, screen for hypertension, diabetes, and abdominal aortic aneurysm. Main use statins wisely. Aspirin only in select younger adults. Smoking cessation, counseling plus medications. So for smoking cessation, these medicines are very important. One is NRT, second is bupropion, and third is varenicline. What are these? NRT, bupropion, and varenicline. These are very important for smoking cessation. These are most effective. So these three are most effective for smoking cessation. Key message here is preventive medicine saves lives by reducing infectious diseases, cardiovascular risk, and smoking related deaths. So I hope you have understand all of this we have discussed here.